presentation, we're doing the soft tissue and joints, and for our disease, we're doing rheumatoid arthritis. RA, or rheumatoid arthritis, is characterized as a systematic autoimmune disease that affects the joints and connective tissue throughout the body. Symptoms of rheumatoid arthritis are often mild, making it often difficult in the early stages. So in stage 1, it's often just thought by the patient that they're just aging or getting old, so they just write it off and don't really do anything about it. It's only in the later stages is when it's usually diagnosed, because that's when the patient comes in with issues. Commonly affects the smaller joints, such as in the hands, in the wrist, and the feet. Can also affect the patient systematically, so it just doesn't have to affect the small joints. It can also affect other joints, just usually affects the small joints. The ecology is idiopathic, but studies point to it being genetic, so like they're not quite sure on what causes it, but most of the literature out there does seem to point towards genetics. And also bacterial or viral infection can trigger that anomaly, that genetic anomaly that can trigger RA. Some symptoms are chronic inflammation and thickening of the synovial membrane. There can be deformities at the metacarpal phalangeal joints, and that basically is just at your knuckles, and that's where it's most prominent. Rheumatoid nodules are firm lumps that can also appear in your hands, feet, and elbow joints. When you look at it, joints are usually inflamed, stiffen, and warm to the touch. Stiffening is more prominent in the morning because you haven't gotten up and moved around yet, and when you have movement, it usually lessens the symptoms. Some other symptoms are fatigue, low-grade fevers, dry eyes and mouth, loss of appetite. Many experience chronic illness or body weakness. Some other complications that you may experience, people are at risk for developing permanent heart disease and diabetes. People with obesity that experience RA may also be at risk for high blood pressure or a high cholesterol due to higher risk of heart disease. In extreme cases, RA can affect the neck and the spinal cord, which can lead to paralysis or death. RA can also make employment quite difficult because of how stiff and how sore the joints can be, so it can make it hard for you to do physical activity, and joints can also become deformed.
There are various stages of RA, as somewhat mentioned before. There are 4 primary stages. The first being that really mild stage where there's just some joint stiffness, pain, and inflammation. And like Grant said, some patients just don't seem to realize that it's a problem. They just think they're getting older and that it's just a little bit of arthritis. The second stage is more of the synovial inflammation where the joints begin to damage. And this is where patients mostly see increased pain and decrease of range of motion. Stage 3 is considered the severe stage, where you're now bone on bone and the deformity at that knuckle line begins. Stage 4 is the end stage, which is pretty much the point of no return, and patients are still experiencing that pain, stiffness, and inflammation, and there's muscle strength is decreased, and that there might be ankylosis of the bones, so fusion of the bones. Prognosis for RA, of course, the earlier you diagnose is the better the prognosis. But overall, the prognosis is pretty poor since patients do tend to come in at later stages, and there's really no way of reversing RA. We're just trying to manage the symptoms and make sure that we can slow down the progress. So our overall goal treatment is to prevent further damage and to manage the disease. The common age for RA includes young to middle-aged women. The highest incident rate is of women in their 60s. Women are 2 to 3 times more likely to develop RA. Women with decreased estrogen levels tend to be at higher risk. Pregnant women have decreased flare-ups because of the increase in hormones, and then vice versa. Patients who are in menopause tend to have increased flare-ups due to decrease in hormones. RA can still happen in men, but it occurs in the older ages due to the fact of decreased testosterone. There is no specific race affected by RA, but there are 1.5 million adults who suffer from RA in the U.S. Risk factors include environmental, which include asbestos, pollution, and other chemicals. Smoking can increase the inflammation. Trauma, having a poor diet, with unhealthy fats and processed foods. Poor exercise, obesity, and then women who have never been pregnant. Treatment goals: patient education is key in order to maintain the flare-ups. Maintaining mobility and preventing deformity to minimize the stiffness and swelling. And then there are medications to control the pain and swelling, which include disease-modifying anti-rheumatic drugs, or DMARDs, NSAIDs, and corticosteroids. In addition to those, we can also have a healthier lifestyle for these patients, including increasing fruits and veggies, your omega-3s. Experts recommend a keto, paleo, or Mediterranean diet. Should avoid sugar, alcohol, processed foods, and smoking. RA patients also tend to lack supplements, and the supplements that they typically lack that they should take in more foods or take vitamins and supplements for include B6, B12, C, D, E, calcium, folic acid, magnesium, and selenium. And then low impact exercise daily is also key. Some examples would be yoga, walking, swimming, something light on the joints.
So our case study, we're going to talk about Clara, our patient who has come in. She's a 47-year-old female. She works part-time in a retail setting and also part-time takes care of her grandchild, 2-year-old grandchild. She has put weight on recently due to her inactive lifestyle because she has been stiff in her joints, hasn't been very active. She admits that she's easily fatigued. She is not eating a healthy diet. She's eating a lot of processed foods, very little fresh vegetables and fruits. She's having a hard time at work stocking shelves, bending down and playing with her grandchild. She also has complained about swelling in her joints, in her hands and ankles and feet. She has noticed she's a little off balance as well when she bends down to either pick up toys or her grandchild. She frequently has a fever and has often missed work because of her joint stiffness or not feeling well. She has recently also learned that she is pre-diabetic, probably from not eating healthy foods. She knows that she needs to make some lifestyle changes to regain the life that she once had, and she's willing to do the work to do it. When she goes to see the doctor, some tests that she could expect to be performed is a blood test to determine what level is your rheumatoid factor, and depending on what that level is, it will determine what stage of RA that she has or could be. Some other blood tests used to determine are the ANA, antinuclear antibodies, anti-salitic, anti-CCP antibodies, the C-reactive protein, the erythrocyte sedimentation rate. The doctor also, some of these blood tests can indicate other diseases like cancer, so you really have to look at the whole picture. And there may be more tests run for that. Some other tests that might be done are some x-rays of the joints or MRIs to see how much affected or if there is any damage done to the joints. The doctor may also do a complete blood count. And of course, there might be more tests done just because some of these results may point to other diseases as well. So some things that we need to consider when treating RA patients. Obviously, education is key. We want to talk about a healthy lifestyle. We want to talk about changing maybe some food intake and daily activities. It is important that RA patients do allow themselves some rest when they need it, when doing exercise or in general. Some passive treatments that we might choose to do on RA patients are hot and cold applications, some electrical stimulation, and some hydrotherapy. So for activities or interventions that we might do are flexibility like yoga, light strengthening, which strength training we need to be careful with because of their stiffness in their joints. We don't want to do heavy weights with that. Low impact aerobics like walking, yoga, swimming, as we had mentioned before. So although there's no cure for RA, unfortunately, what we want to do as PTAs in the healthcare facility is prevent the disease from getting worse. We want to slow it down, and we're looking at quality of life, so continuing movements and making things better for the patient to get around.